Hi, good day. Today I want to discuss with you black toenails. The black toenails that you obtain from trauma to the nail, whether it's hiking, running, bumping your toe, dropping something onto your toe, anything like that. It's not the black toe that develops overnight in a high-risk patient that has got very poorly controlled diabetes or with very poor blood supply or any other medical condition. So this is for that nail that's just gone through trauma, walking, running, and you're otherwise quite a healthy individual. Okay, so what will happen, how it will manifest. If you're not wearing any nail polish, you'll most probably notice that under your nail, and I'm just going to use my thumbnail, that is the nail, but that's also the nail bed. So what you will notice is straight away there will either be redness or it will be already black, and if you take your nail polish off, that it will be black. So what the blackness is the dried blood. Because what happens is that when you hit this nail or when you bump it or from constant friction and trauma to that area from running or something like that, that will cause the nail to loosen from the nail bed, and that then often causes the bleeding, which is the blackness underneath the nail. And what happens is that the nail and the nail will loosen from the nail bed, but it will still be intact around that area over there. So that's also why you experience that extreme pain. It's because of the pressure build-up of the blood in that area, because remember, your nail is attached to your nail bed. There's no space for any fluid or anything. All of a sudden now, because of the trauma and the nail bed tearing loose from that nail bed, there's blood, so there's increased pressure in that area there, and that's why you're experiencing the extreme pain. And as I said to you, there could be, I had 2 cases during lockdown where I had to go to work because it was people that were in absolute agony and they didn't do anything major. They basically walked up their stairs and maybe bumped their toe and they were in agony. So what will happen, or what you can do straight away when something like that happens, obviously, as I said before, if you're not a high-risk patient, what really works, and I've seen it this week again, is that you soak your feet in lukewarm water, as warm as you can handle, obviously not boiling water and not water that's going to burn your skin. And then you add Epsom salts or salts to it, dissolve it in there, and that actually helps to relieve that inflammation and that throbbing and all of that. And just soak your foot in there for a couple of minutes, a good 10-15 minutes, and do it a couple of times during the day. Once you've had that immediate trauma, what one can do if you have a special interest in treating feet, like myself, you can't really do it at home. I won't advise you to do it at home, but you need to relieve the pressure. So you either drill a small hole into that nail, which will relieve the pressure so that we can get rid of all the blood. But what you also need to remember is that you've got a sterile environment. It's like under a blister, a sterile environment there. So you don't just want to rip the nail off or cut it all out, because then it opens up a passage for infection. Or you can make a small, we'll make a small area here where we just sort of try and draw all the blood to get the blood out of that area. Otherwise, if you're at home and you can't do anything, you can't get to anyone, just soak that foot and you will see it will ease. Maybe apply an antiseptic ointment to that area there. Then what's going to happen, then also it's good to apply a plaster to that area. So one of 2 things can happen. Your nail can either reattach to the nail bed as the blood sort of just disappears. Your nail will reattach to the nail bed and will grow out normally. Or what will happen, which is obviously the cases that I see, is that the nail don't reattach to the nail bed. So after a few days or a week, maybe the pain will subside. It will still be sensitive, but it won't be that throbbing pain. That throbbing pain usually lasts for about 2 days. And then what will happen is that the new nail, by the time we remove the top nail, and I'll get to the removal of the nail now, there is usually already a new nail that started to grow out from there. Because remember what I've taught before is that your root is situated there where your skin is, in that area there. So it all depends where the damage was done, whether the nails only lifted that bit or it's lifted that entire area there. When this happens, do not have your nails surgically removed, because when they remove it surgically, all that they're doing is that they're just doing actually more damage to that area there. It all depends what the nail presents like, how you're going to treat it. But your first line is to try and relieve, to try and get rid of the blood. And once the blood is dried and it's just black in that area there, you want to trim the nail that's not attached to the nail bed. You want to trim that away. And then what's very important, but it's all non-surgically, Then what's very important is that you want to start treating that nail bed. So often when you remove that old nail that was completely lifted off the nail bed and the nail bed started healing, you'll find that your nail bed is quite hard and there could be a bit of callous skin or something like that. And then it's good to use an ointment and actually massage it into that nail bed, because by massaging in the nail bed, you're increasing the blood supply to the nail bed, which will help with the nail growth. And also by massaging the nail, you're softening the nail bed. And with softening that nail bed, you're creating an optimum nail bed for the new nail to attach to, and that the new nail can just take on that normal shape of the nail bed and it will grow out being an absolutely normal nail. But if you find that there was a lot of damage that was done to the nail bed through the trauma, then you need to see someone that's specialized in treating feet with a special interest in obviously nails. And then there's various treatments that one can do to try and encourage that nail to grow back normally. But it's all usually quite conservative treatment. It's not surgically that we need to do anything. And we do treat the nails quite successfully, that nail can grow out where it's not ingrown and it looks normal, and then one can go from there. Continual trauma to the same nails, like with running, it could be because of your running style that's incorrect. If you get recurrent black toenails, then it would be advisable to go and see someone that they can have a look at your mechanics and your shoes, and because all those factors, your socks, all those factors could be contributing to your black toenails. And it's not always shoes that are too small, shoes that are too big. It can sometimes just be because of the mechanics, the way you run, the way you walk, that you actually get the black toenails. And then obviously I have professional athletes that I treat, and they have continual black toenails, but it is because of the sport that they do, and it's because of their running style being more on their toes and the amount of pressure that takes that the nails take. And we treat it conservatively to relieve the pain, but from a cosmetic point of view, for it to look nice, we'll continue with that after their career. But yeah, otherwise, black toenails are not normal. So if it's a recurrent thing, you need to go and see someone about your biomechanics. And if it's a once-off thing that you've traumatized it, soak your foot in lukewarm water, try and treat it conservatively, massaging that area there. And otherwise, if you see that it is a problem, then you need to go and see someone, a professional, that can help you with that and have a look at that. Okay, thank you.